Good morning, Paul. Thanks for coming in here to talk to us today. Now, you're a urology nurse, is that correct?
Yes, that's right. I work in a urology clinic where patients come for a variety of reasons relating to problems with their urinary tract system, or their waterworks as many like to call it. I run a monthly clinic specialising in bedwetting in young adults. We found that having a separate clinic for this group has been very successful in opening the lines of communication about a sensitive topic.
Before you talk more about your clinic, can I ask you to tell us what is meant by the term bedwetting?
Your listeners may be surprised to hear that bedwetting, or nocturnal enuresis to give it its medical term, is actually a sleep problem. It happens when a person is unable to wake up to urinate when they have a full bladder. In fact, children who wet the bed are often described as deep sleepers. Although it's important to treat each person as an individual, it's generally accepted that most children are dry during the day by the age of 4 and dry at night between the ages of 5 and 6. So, nocturnal enuresis after the age of 6, around the time when many children start school, is something that needs to be looked at as it may be linked to more serious conditions such as ADH or antidiuretic hormone insufficiency.
I see. Now, you mentioned that you run a clinic for young adults. How common is the problem in this age group?
Fortunately, it's quite rare, but that fact shouldn't downplay the traumatic effect it has on a young person. It has been estimated that no more than 3% of teenagers and young people wet the bed at night. However, 20% of young people have what is known as secondary enuresis, and this means that they've started wetting the bed after being previously dry for at least 6 months.
What are the differences between bedwetting in both groups?
Let's talk about young children first. Some children have an underdeveloped connection between the bladder and the brain, so the need to urinate might not be communicated in time for the child to wake up. Once this develops, most children grow out of bedwetting. However, children who have chronic constipation or whose urinary tract has not developed properly may continue to experience nocturnal enuresis and often require management of these conditions before a child can become dry at night.
What about young adults?
Well, a significant majority of adults who wet the bed have overactive bladder muscles. The muscles of the bladder, called the detrusor muscles, relax when the bladder fills and contract when it's time for the bladder to empty. Abnormal muscle contraction can be caused by faulty nerve signals from the bladder to the brain or by an irritant to the bladder, for instance caffeine, alcohol, or certain medications. Unfortunately, bedwetting in adults has a tendency to continue and also to become more severe. Some of them are wetting the bed 3 or more times a week.
The effect on older people must be
devastating in many cases. It has an impact on so many aspects of their lives, their work and their relationships. Most of the people I see feel ashamed of what they perceive as a lack of control over something they should be able to control. Sadly, by the time I see them in the clinic, they have low self-esteem, sometimes to the point of self-loathing. Most have decided not to seek out a life partner or even go on a date.
What about the treatment options for adults?
Although there are several ways to manage the problem, many adults erroneously believe the condition is untreatable. I was quite shocked to read about an adult bedwetting study that suggested less than a third of participants thought their condition was treatable, and up to half of the respondents had never sought any medical advice about their problem.
For those who do seek treatment?
There are 3 options. Lifestyle changes such as no drinks after 6 p.m. and alarm sensors which sense the beginning of wetness. Medication and surgery as a last resort. Drug therapy includes medication to calm overactive bladder muscles and medication which reduces the amount of urine produced by the kidneys at night. Most surgical procedures aim to correct anatomical abnormalities.
What gives the best results?
Alarm training is one of the most effective treatments for bedwetting, but it comes with a few challenges. Alarm training is quite embarrassing and difficult to continue for the 2 or 3 months it takes to become dry. The alarm sensor is worn in the underpants, or the sensor is placed on the bed as a mat. Patients who are deep sleepers and who fail to wake up when the alarm detects wetness or a vibration have to rely on someone else to wake them. And as you can imagine, this can be humiliating for an adult.